there. Welcome once again to the program, Your Doctor in COVID. I'm Dr. Mahendra Carpen, Head of Medical Services and Cardiology at the Georgetown Public Hospital. And today we'll be talking about some of the effects of strategic lockdown when it's prolonged, and some good things and some bad things that we need to consider when employing this strategy. As usual, you can see I'm wearing my mask and it's covering both my nose and my mouth. It's not under the nose and it's not under the chin. This is the correct way. I'm going to take it off because I'm alone today and there's no one here to put me at risk, and I'm putting no one else at risk by taking off my mask. So let us look at a concept that has been around for the management of COVID-19 pandemic and the effect it has on healthcare systems. So let's look at a graph that represents something called flattening the curve. And let's explain this a little bit. Let's look at the number of cases versus the time since the first case was diagnosed. And if you look in the middle of this graph, at the line running from left to right, you will see, let's imagine that that's the capacity of the healthcare system. And in Guyana, we know what our capacity is. We know what number of ICU beds we have in the public as well as the private sector. We know the number of doctors, the number of nurses. We know how many ventilators we have. So we know our capacity. And so let us look at what can happen if there are no measures put in place to prevent the rapid spread of this condition. Very quickly, the number of infected cases that are admitted to hospital can rise above the resources available. And when that happens, the fear is that it can crash healthcare systems. We have seen on the news and we have seen on the internet that there are times in countries that were overwhelmed, and these are first world countries, where they had to store bodies in mobile freezers, in 40-foot and 20-foot container trucks outside of hospital because the death rate was so high and they could not cope. And so that is a big concern for all healthcare systems. And if you imagine if the first world systems could not cope with that kind of problem, what would happen in a country like ours and other third world countries if we become overrun by the number of admitted cases versus the number of our available resources? So therefore, we have to take something called protective measures. And if we were to look again at that same graph, you will see in blue what you can do by adopting safety measures and protective measures. And what are these? The simple things like hand washing, social distancing, strategic lockdowns. These can work to spread out the number of admitted cases over a period of time that would allow you to actually cope with the number of patients needing healthcare resources. And so this is the whole concept of what is flattening the curve. It does not reduce the overall number, but it actually reduces the rate of infection and admission to a state where you could actually cope with it in your healthcare system. This is a very real and serious issue. COVID-19 is here to stay for quite a while. I want you to understand that very clearly. It cannot be effectively contained or eradicated as things are right now. We are hoping for vaccines, we are hoping for immunity, we are hoping for the development of effective interventions, cures, cocktails, antibody cocktails, etc. Everything we have is being focused on how to minimize the effects of this pandemic and how to beat it. Continued spread is actually inevitable, and almost half of the population will at some point be exposed. And some concepts of herd immunity may actually become a reality in many countries. Flattening the curve that we spoke about just now distributes the mortality and morbidity over time. And this allows the healthcare system to actually cope with it. The second wave that usually happen in these pandemics, what we are seeing, it's proportionate to the severity of the initial lockdown. So countries that had very severe, strict initial lockdowns, when they open up back, they start to get a much worse infection rate, a mortality rate, and a morbidity rate. Admissions to hospital are much worse the stricter the first lockdown is, versus countries who had a less strict lockdown in the first encounter. Those countries, when they open up back and they start to see increasing numbers, guess what? The severity of infection seems to be less, hospitalization seems to be less, death in hospital seems to be less. So it gives one a lot of things to think about how strict should lockdowns be and how actually useful it is to employ strict lockdowns. So that is something that has caught the attention of the WHO. And just recently, the WHO actually reversed some positions on the use of lockdowns. Lockdowns have been used to control the coronavirus around the world. And the effect of that, it has plunged millions of lives in chaos. The WHO has changed its mind. It has now said that we should stop using lockdowns as the primary method to control the coronavirus. They have also claimed that the only thing that lockdowns achieve was poverty. And this is a very, very strong claim. And I will quote here, "Lockdowns just have one consequence that you must never, ever belittle, and that is making poor people a lot poorer." And that is coming from the World Health Organizations. So I will summarize their position for you. Lockdowns are not primary means to control and eradicate the virus. Rather, the lockdowns help us to buy time to reorganize, to regroup, and to rebalance our approach to the COVID-19 pandemic, especially in the health sector and where healthcare resources are limited. So therefore, lockdowns will actually help us to manage our resources. And of course, it helps significantly to protect the already overworked and exhausted healthcare workers. So let us look at some of the unwanted consequences of a prolonged lockdown. For the individual, it is well documented that persons subjected to a prolonged lockdown can develop lots of psychiatric changes in their behavior, like mood swings, increase in stress level, disturbed sleep pattern. They can develop anxiety-like symptoms like a pounding heart, generalized tingling of the body, all kinds of manifestations of other disease processes can happen, bloating with gas. Your mental capacity can become affected depression is increased, anxiety, and of course lots of persons with anxiety will develop symptoms of shortness of breath that can be confused with COVID-19 expression of the disease. What we know about prolonged lockdowns is that it actually affects poor people more. There has been an increase in world poverty because of prolonged lockdown during the COVID-19 pandemic. There is an increase in childhood malnutrition. There is decrease in effective vaccination programs around the world. And so do not be surprised in the future to see resurgence of diseases that were under control by vaccines, like smallpox, chickenpox, and polio, etc., mumps and measles. Those things may have a resurgence because of our lack of the vaccine program. There's been an increase in domestic violence, child abuse, elder abuse, more substance abuse of persons, especially those who are off of work, who have been laid off or furloughed, people fired. These things can affect people very, very seriously. And of course, there's an increase in unemployment across the world because of this. And then, of course, there is not just the mortality or the death rate from COVID-19 directly, but all the other disease processes that people still have to cope with. There is no decrease in diabetes or hypertension or heart attacks or stroke or kidney failure. So when one looks at comparative mortality or death rates, for example, for the last 5 years, and compare it to, let's say, 2020, in the US, what we see is a 33% increase in what is called excess deaths. And these are very, very concerning because a number of these persons in a non-COVID pandemic would have sought attention at hospital and perhaps lives would have been saved. The leading cause of non-COVID excess mortality is, again, heart disease. And these are things like heart attacks, heart failure, sudden cardiac death. These patients in a non-COVID world would have sought attention perhaps earlier in hospital, and there are things that can be done to actually save their lives. In the early part of this pandemic, angiograms and cath labs and stents and angioplasty, etc., everything was changed. So a patient coming into hospital, even in the US, who have a massive heart attack, they would choose a certain approach to managing this patient, which is not the best, but it is adapted in a COVID environment. So these patients would receive thrombolytic medications instead of going straight to the cath lab and opening up their blockages that can save their lives and prevent them from getting into heart failure. So we've had to adjust significantly the way we manage other cases due to the COVID-19 pandemic and the risk to the staff and the hospital's system when these patients come into hospital, because everyone used to be considered as a potential COVID carrier that can infect and crash the emergency room, the cath lab, the hospital in general. In long-term care facilities, there has been about 82,000 deaths in the US in nursing homes. There's 33 million people that have been forced into poverty, and over 300% increase in people who thought about committing suicide during this pandemic. And the one that is the saddest for me, childhood malnutrition and hunger is up by 200 to 300%. So we have very, very serious and regrettable effects of prolonged lockdowns. And when we are advocating policies, we have to bear all of these in mind. So I believe the best approach would be to find the right balance between strategic lockdowns and protective measures and the ability to continue having a life where people can have some semblance of normal mental health, as well as they can have meaningful activities to put food on the table for their families. Thank you very much for watching, and thank you for listening, and do have a pleasant evening or a pleasant day ahead of you.